driving transmission risk. This is because we're collectively not succeeding at breaking the chains of transmission at the community level or within households. We need to close the gap between intent and implementation at the country and individual level, because at present there is immense pressure on hospitals and health workers. With almost 2 million deaths and new variants appearing in multiple countries, the Emergency Committee emphasized the need for governments to do all they can to curb infections through tried and tested public health measures. The more the virus is suppressed, the less opportunity it has to mutate. We need to be more efficient than the virus and reach excellence in everything we do. There is only one way out of this storm, and that's to share the tools we have and commit to use them together. The committee called for upgrading national sequencing capacity so that as the virus changes, we can effectively monitor and respond to new challenges. This is a defining moment in the pandemic, and I was pleased that the Emergency Committee put a major emphasis on rolling out COVID-19 vaccines equitably. Health workers are exhausted. Health systems are stretched, and we're seeing supplies of oxygen run dangerously low in some countries. Now is the time we must pull together as common humanity and roll out vaccines to health workers and those at highest risk. This is key to saving lives, protecting health systems, and driving a fair recovery. We have also developed updated guidance about how to best protect people in long-term care facilities and recognize that if they are isolated, it has a profoundly negative impact physically and mentally. The guidance aims to prevent the COVID-19 virus from entering the facilities and ensure our loved ones remain safe. I was really pleased to see refugees in Jordan start to be vaccinated this week. I truly appreciate the approach taken by the Jordanian government to ensure that refugees are not left behind. It's critical this momentum on equitable vaccine rollout continues in the weeks ahead. I came into public health because I wanted to ensure that everyone everywhere has access to quality health services. I know what it's like to come from a continent where not all health services are available. When AIDS drugs first rolled out, they were only available in rich countries until a historic movement of health advocates, civil society, and manufacturers provided a rollout of low-cost antiretroviral drugs. In the H1N1 pandemic, by the time low-income countries received vaccine supply, the pandemic was over. We don't want this to be repeated. COVID-19 vaccines are a major scientific breakthrough, and I know through COVAX that we will distribute them a lot more effectively than in the past. We're working hard, but we must also do more to ensure that vaccines reach those that need them most. I will keep repeating this over and over again during the coming weeks, because, as I said on Monday, I want to see vaccination underway in every country in the next 100 days so that health workers and those at high risk are protected first. I'm looking forward to the Executive Board next week and working with manufacturers and countries to ensure that vaccine supply is available and distributed equitably around the world. I now want to turn to the chair of the Emergency Committee, Professor Didier Houssin, to discuss the recommendations from the committee. Professor, you have the floor.
Thank you very much, Dr. Tedros, and good morning, good afternoon, good evening to you all. The Emergency Committee met yesterday, and I want to thank first the members of the committee for their work and contribution to these recommendations. It's a sad anniversary because nearly 1 year ago, the Emergency Committee recommended and was followed in considering that the event considered a public health emergency of international concern. Since that time, as Dr. Tedros said, 90 million people contaminated, nearly 2 million people died. And the committee focused on two things. The first is a worry about the variant which starts circulating in some places in the world. This variant requires a strong and quick effort in research, in collaboration between research teams, in sharing of information, as suggested and mentioned by Dr. Tedros, and also about data sharing. I think we are in a race between the virus, who is going to continue trying to mutate in order to spread more easily, and the humanity which has to try to stop this spreading. And this effort of research needs to be very, very quick and very intense. Fortunately, there is also a good news. Good news is about the vaccine. But this good news should not be transformed in bad news. And we should remember that the objective for 2021 is 20% of the population vaccinated, not only in rich countries, but also in low and middle income countries. And it's extremely important not to transform this good news into a bad news. So, and for the vaccine, of course, some of the recommendations of the Emergency Committee are about trying to know more about the efficacy of the vaccine, the efficacy against the new variants, etc. I will not go into the detail. I would like to add a final point about the situation in which the world is presently. We are a little bit paralyzed, we are a little bit confused, and clearly the question of travel inside the world, around the world, by air, by road, by sea, needs to be better, perhaps possible and organized. And this is why one of the recommendations of the committee to WHO was to take a strong lead in order to produce a very clear guidance and scientifically based guidance about how best to facilitate and permit the circulation of people in a safe manner by air, by sea, and by... I thank you for your attention.
Thank you so much, Professor. These recommendations are very important as the world fights COVID-19. The greater the solidarity we have, the more lives we will save and the quicker we will end this pandemic. Thank you so much again, Professor. I thank you, and back to you, Fadila.
Thank you, DG. Thank you, Professor Houssin. I would like now to open the floor to questions from journalists. I remind you that you need to raise your hand under the raise your hand icon in order to get in the queue. I would like to start with Christophe Vogt from Agence France Presse. Christophe, can you hear me? Christophe? Can you please unmute yourself, Christophe? We cannot hear you.
Okay, that should be done now. Can you hear me now?
Very well. Go ahead, please, Christophe.
Okay, I'm really sorry about that. I'm having a question about what Dr. Houssin just said and what has been said in the last few weeks when the vaccines arrived and with the variants. It's a bit confusing. We had light at the end of the tunnel, at the end of the year, and then 2 or 3 days ago, Dr. Ryan talked about how this year could be even worse than last year was. And so how can we reconcile the fact that now we have efficient vaccines and still this idea that things could get still worse?
Dr. Ryan will start.
Thanks for your question. I think this is a matter of deciding the future. We have an element of control on the future we want to have. We have, and we did also warn in 2020 that if we were to rely entirely on vaccines as the only solution, we could lose the very control measures that we had at our disposal at the time. And I think to some extent that has come true, for different reasons. Because people are more inside in the Northern Hemisphere, because the holiday season pushed and brought people together and people mixed in a way that they might not otherwise have done. We've seen Northern and Southern Hemisphere increases. It's not just in the Northern Hemisphere. If you go to the southern cone of the Americas, in Argentina, in Chile, in Paraguay, in Uruguay, and in Brazil, we're seeing difficulties there. This phenomenon of a rapid acceleration of cases is in the Americas. It is in Europe. It is in some countries in Africa, and it is in some countries in every region. So that is the reality, and that's happening for a reason. And a small proportion of that may be due to the emergence of variants that are fitter. But the large proportion of that transmission has occurred because we are reducing our social physical distancing. Our behavior is, as the DG said in his speech, we're not breaking the chains of transmission. The virus is exploiting our lack of tactical commitment, our fatigue, the breaking down of our behaviors. The vaccine is light at the end of the tunnel. It is a hugely, it's a massive advance, but it doesn't answer and it won't address every question that we have. We have to continue doing the other measures. And even with that, and Bruce will speak to this, if vaccination is going to be successful, people have got to get vaccinated. And for people to get vaccinated, countries have to get vaccine. And therefore, it's not just an equity issue about countries getting vaccine, it's about protecting those around the world who are most vulnerable, our frontline workers. So we want to start the year on a hopeful note. I think what the Director General is trying to do is start the year on a realistic note. We need to be real with ourselves. We need to be honest. We're not doing as well as we could. We've learned so much about the virus. We know more than we've ever known before. We have more tools. We have to sustain the effort. It's tough. We've got to pick ourselves back up. Many of us in the Northern Hemisphere in the New Year, where people have been celebrating holidays. Many people in the Southern Hemisphere similarly, they're confused because they think, oh, this disease is seasonal. It shouldn't be here. We're in the middle of summer. And again, this idea that we've assigned seasonality to a virus, we assign these values to the virus that were never proven scientifically. We need to recommit ourselves to the basic measures. We need to decide that this disease stops with me. Individuals need to let the disease stop with them. Communities need to ensure that the disease stops with them in clusters. Governments need to support communities and individuals to do that. And I've said it before, we're expecting our communities to do extraordinary things, to separate themselves in extraordinary ways, to make huge sacrifices. In order for that to be successful, governments need to support communities in extraordinary ways. And within all of this, all of us, none of us are doing enough to make this all work. Everyone's got to recommit themselves and increase the level of commitment. We're all working hard. Everyone's working hard. We're just not working hard enough. Bruce.
Thank you, Mike, and thanks for the question. We do have efficient vaccines, but remember, we're in a situation with an escalating virus right now. We have, in terms of numbers and transmission in many parts of the world, we have a virus that is also evolving, and we have, against that background, as Mike said, a decreasing what we call stringency in the application of the measures that we have. And when you put those three things together, you're making it easier for the virus, and the virus is taking off. So things can get worse, numbers can go up, and we're seeing that. Against that, we have vaccines, yes, but we have limited supplies of vaccines that will be rolled out slowly across the world. And we also have, vaccines are not perfect. They don't protect everyone against in every situation, as you know. So as a result, the situation could definitely get worse in the short term. And we also have hesitancy against the vaccines in places. So it is not the silver bullet, as the Director General has reaffirmed and Mike multiple times. But there's very good news, of course, because now we have 3 lines of defense, but we have to use them all. The first line of defense we're starting to roll out is the vaccine that can protect people from getting infected. And then we have diagnostics, and we have new rapid diagnostics that work well. They give a second line of defense, so you can find the ones who get infected, you can rapidly isolate, rapidly quarantine. And then we have the third line of defense. For those people who are infected and get sick, we have dexamethasone, oxygen, as Maria lays out all the time, very, very good clinical pathways, and you can save lives if all of that is applied. But no one part of this works. You have to use all 3 lines of defense, or the situation will continue to be very bad. And that middle line of defense is still about finding cases, getting them isolated very rapidly. Not just hospitalized, but the mild and moderate cases at home. We have to make it easier for people to isolate so that they don't infect other people. You need all of that. Vaccines such an important part of the solution, but this is a complex situation, and we need all pieces of this working together.
Thank you. Maria?
Yeah, thank you. I just wanted to highlight the point you made about the light at the end of the tunnel. There is a light at the end of the tunnel, but that tunnel is a long tunnel right now, and it's dark and it's dangerous and it's a challenging one that we have to get through. But we have the tools to help us get through that. And more and more and more are coming online. But please don't forget about the tools we have in hand. We're all in a challenging situation. We're tired. We're frustrated. We want this to be done. But we have to be part of the collective action towards ending this. We have to be part of the collective action to prevent ourselves from getting infected. And if we do get infected, the virus stops with us. We don't allow this virus to pass from us to someone else. And we have the tools in hand to do that. Whether this is related to a virus variant, these variants will be detected, and it's confusing and it's scary, but the virus itself is enough to scare us into action. We need individual information to turn into action. We need knowledge to turn into action. We need intent to turn into action. And all of us have a role to play. But it's not just up to individual level measures. We need our families. We need our communities. We need governments to provide supportive environments in which we can take those actions. We need not only good testing with rapid turnaround results. We need those tests to link to public health action so that we know where the virus is circulating. And we know if I'm infected or if I'm a contact of someone who's been infected, I need to know what to do, and I need to know that I will be supported in being in quarantine and that I can protect my loved ones. We have a very different situation around the world. Many countries have shown us the hope that by doing all of this collective action, by putting in the hard work through a comprehensive strategy, not one measure alone, many measures together, applying them in a comprehensive way with strong national plans, implemented, adapted, agile at the local levels, tailoring it to the specific needs of the local level. They've shown us the way. We have outlined guidance in support of all of our member states, in support of everyone everywhere about what needs to be done, and we know it's hard. But we have it demonstrated over and over again that it works. So this is why we sit up here and repeat that there are many things that we can do. Vaccines and vaccinations are another tool that will help us get to that light at that end of the tunnel, but it will take time. So there's a frustration, and I understand that, and all of us understand that because we feel it too. But it will take some time. But let's look at the hopeful angle here, and that we are lucky in the sense that we do have tools. We need to make sure that that luck and that hard work and these vaccines reach all people all over the world, and the COVAX facility and the commitments that we have seen across the world to make sure that that turns from not just words but into action becomes a reality. So there's a lot that we can do. So I just wanted to highlight your light at the end of the tunnel. There is a light at the end of the tunnel, and everyone that's listening to us today needs to know that there's something they can do. They need to feel empowered, and if you don't know what it is you can do, come to our website or reach out to find out how can I help, because all of us can be part of the solution to a very challenging situation that all of us are in together.
Thank you. I would like now to invite Tony Waterman from Asia News Channel to ask the next question. Tony?
Thank you very much for taking my question. It's just on the WHO team of experts that has now arrived in Wuhan. I believe the video meetings began today with Chinese counterparts. I'm just wondering if there's any update on these initial meetings, or if you could provide any more specific information about what sort of cooperation is going to be carried out, and how the potential identification of patient zero in Italy from November will sort of play into this investigation into the origins of the pandemic. Thank you.
Dr. Ryan?
Yeah, the team did immediately begin work, and will be working with Chinese counterparts to implement the terms of reference as we've agreed, and getting more specific on the specific data and the studies that we want to see, and the follow-up studies that need to be carried out. But I wouldn't, at this stage, I think it's very important that the team are going to have the need to be able to engage with their scientific counterparts in China. We can't debate this every day. What do they do today, tomorrow? What do they do the next day? They have to have the space to be able to do the work. And therefore, Maria can outline in more detail the overview of what we want to achieve. But this can't be paced on a daily basis and litigated in press conferences. I'm sorry, because this is not the way we would do outbreak response or outbreak investigation or origins investigation in any situation. However, our team will be in touch with the media in the field. There will be regular briefings, and I'm sure that we will be able to keep you updated on the day-to-day activities. But forgive me for not getting into the detail of what the team is achieving on a daily basis.
Thanks. I'm not going to give you any very detailed response either, because as Mike said, the team needs to do the work. So the Chinese counterparts and the international team have been meeting regularly and been talking by teleconference. And now that the team is in Wuhan, they're going through their quarantine period, but they're meeting again by video conference. Once they finish that quarantine period, they'll be able to meet face to face. And anyone who's ever been involved in, visiting the field or in these outbreak types investigations, these studies take time. Mainly what will happen is a series of studies, and these series of studies have already begun, looking at some of these initial patients from December, and epidemiologic studies, seroepidemiologic studies, and review of past work that had happened in the markets, that have happened with patients. So it's a number of things, but we won't be giving a day-by-day update of what the team is doing. What we do need to do is let them do the work and carry that out, and put the information that all of them are learning together into context and planning the next series of studies. You mentioned a report from Italy, and you refer to this person as patient zero. We need to be very careful about the use of the phrase patient zero, which many people indicate as the first initial case. We may never find who the patient zero was. What we need to do is follow the science. We need to follow the studies and make sure that they are done comprehensively. Any report of cases that were detected through either looking at clinical samples, stored clinical samples, or stored sera into 2019, we are following up on. We are reaching out through our global networks, contacting the researchers directly to find out more information and set up collaborations for potential further work of any samples or studies that remain. So we will continue to follow that, and we will report as much as we learn when we learn to you. But it will be put in a collective understanding of the science. So yes, so the team is there. They're very happy to be there. They're very happy to be working with their Chinese counterparts, and we're thrilled for them to be able to have this time. But Bruce and I spent some time in China, and we are grateful for the opportunity to have worked directly, scientist to scientist, to be able to have that level of interaction. So let's let them do the work. Let's let them follow the science, and we will report when we can.
Fidela, can I just follow up again? Because I think it's important. The Director General and his mission to China in January 2020, as early as that and before that, in terms of the various meetings here, the issue of the origin of the virus and the animal-human interface was on the agenda. The mission to China in February, the animal-human interface and the origin of the virus was on the agenda. The World Health Assembly in May formulated a resolution asking the Director General to deploy a team to follow up on that issue of designing studies that would allow us to reach some better knowledge on this. A team was deployed in June, July that went to the field to do that preliminary discussion with Chinese colleagues on the ground. Subsequently, we've been planning that mission. That mission has now been deployed and has arrived in Wuhan. That mission has 10 of the finest scientists I've ever worked with on it from different countries around the world, covering a huge range of skills, supported by WHO team and in the context of the Global Outbreak Alert and Response and Network support. The global scientific community has to come together in a network with Goran at the request of the Director General to deploy a team to work with Chinese counterparts to find the scientific answers we need so we can learn more about the origin of this virus. They are in Wuhan today. I think we do need to give them the time and the space to do that work. We do thank our colleagues in China for working with us to achieve this. These things are not always easy to achieve, and we do thank them for that. We thank our colleagues in Singapore for facilitating the transit of our team, and all of those who are working so hard to ensure that we all get the scientific answers that we need so we can protect public health now and into the future. So in that regard, we should see today as the culmination of a lot of work to put together this process. And as Maria said, there are no guarantees of answers. We've seen the same in previous epidemics of emerging diseases. It is a difficult task to fully establish the origins, and sometimes it can take 2 or 3 or 4 attempts to be able to do that in different settings. So I do hope that I wish the mission luck in the field. They're a wonderful group of people, and we trust with the cooperation and the hospitality of the Chinese government, the Chinese people and the authorities in Hubei and Wuhan, we will have a successful mission.
Thank you both. I would like now to invite Jamie Keaton from Associated Press to ask the next question. Jamie?
Thank you, Fidela. Can you hear me?
Yes, very well. Go ahead, please.
Happy New Year to you all. It's nice to see you again. And I'd just like to say that I think that I speak for much of the Geneva Press Corps in saying that I hope that we'll also see WHO spokespeople return to the UN briefings here. My question is for Dr. Hussin. I'd just like to thank you for your recommendations. They're very illuminating. I just wanted to ask you about the recently announced travel bans that we've seen in places like the UK or in other places, particularly with travelers coming from South Africa or the UK in particular. You mentioned in your recommendations that countries should apply evidence-based approaches with regard to international travel. Could you just elaborate a little bit on that, and just could you help us understand if, in your view, these bans on travel are justified by the science? Thanks so much.
Thank you, Jamie. Professor Hussin.
Thank you very much. Thank you very much, Mr. Keaton. Well, this is not an easy question because we tend to live with, of course, the lessons from the past with regard to travel in the context of the international health regulations. But with coronavirus, things have changed. And it's necessary to reconsider perhaps some of the orientations which were commonplace in the context of the IHR. And this is where science-based can perhaps modify some attitudes. At the moment, what we see is that there is a great disparity in the behavior of the member states about testing, about quarantine, about bans, about visa, suppression of visa, etc. And this is why we didn't go into the details of what should be done. But our recommendation to WHO was that it was really time to reassess what could be recommended, what guidance could be provided with regard to air travel, sea travel, land borders, considering the new scientific information provided with coronavirus. This is our recommendation. Of course, I cannot give you a precise response about what should be recommended, but the recommendation was really to put a strong focus on this difficult topic, which may lead us to see things a bit differently from the previous years, for example, at the time of H1N1 influenza pandemic. Thank you.
Thank you, Professor Houssin. I would like now to give the floor to Dr. Carmen Dolea, Unit Head EHR, to complement the answer. Dr. Dolea, you have the floor.
Thank you very much, Fadela, and thank you very much for the question. And to complement what Professor Houssin said, the chair of the Emergency Committee, we welcome the continued advice and recommendations from the Emergency Committee that build on the current work that we have been doing. And just to let you know that we have published recently an updated guidance on considerations for implementing travel-related measures to address transmission of COVID-19, transmission of SARS-CoV in the international context. And this guidance is promoting a risk management approach for countries, whereby they take into account, when they issue the measures, a number of elements that can influence the suppression and the risk of transmission via travel of the disease. So we propose that in this guidance, there are basic approaches that continue to be done in terms of self-monitoring travel advice. There are also additional approaches that can be done based on an assessment of the risk in arriving country, of the capacities of destination countries, and of the health system surveillance and response. And these approaches we will continue to refine these guidance and approaches based on what we begin to learn from countries on the effect of these measures on actually suppressing or influencing the transmission of the disease at the international level. The recommendations of the review committee will continue to work with partners in the aviation and transportation sector to calibrate better the measures and the advice that we give on countries based on the assessment and the evidence that these measures can have on reducing international spread of the disease. I hope this answered the question. I don't know if Mike can supplement.
Hi, Jamie, and Happy New Year to you as well. Maybe let me give you one example, because you're asking specifically about the science-based approach, and as Carmen has outlined quite correctly, a risk management-based approach. If you look at the recommendation made by the committee around vaccination for travellers, it says at the present time that the committee does not recommend to include a requirement of proof of vaccination for international travel. Not because that won't be a good idea in future, but because we are lacking critical evidence regarding whether or not persons who are vaccinated could be infected or continue to transmit disease. And because nobody in the world beyond health workers and very vulnerable people have access to the vaccine. The committee is not saying don't. What the committee is saying is, at this present time, scientific evidence is not complete. There isn't enough vaccine, and therefore we shouldn't do that now and create an unnecessary restriction to travel, a barrier to travel that's artificial, until such a time as we have the evidence and the vaccine. And I think that's the way the committee has approached things. This is about taking the principles of science and precaution, using the best evidence one has, using a risk management approach, and we appreciate the recommendations of the committee at this time. But that will change over time, and there may be different reasons in future to do that. So we're trying to protect the travel space and ensure that economies are not entirely isolated, but recognizing that a small island nation is very different to a nation that's landlocked in the middle of a continent. The consequences economically and socially of preventing or stopping travel are different for each individual, family, community and country. It can only be made as a decision at that level. There are attempts, and very laudable attempts, amongst economic integration organisations like the European Union to try and harmonise the rules around travel. I think that's a very positive thing, and we should encourage that.
And what Dr. Michael Ryan there is speaking about is the recommendations made by the Emergency Committee of the WHO that is being chaired by Professor Hussein, who is saying that it's a very sad anniversary. 1 year ago, they were called upon to look at this global health crisis, which is COVID-19. And what it's saying, that committee, is that there needs to be guidelines from the WHO, especially on public health emergency measures taken by countries, saying that they are approaching it disparately, especially when it comes to things such as travel bans, quarantines, including, of course, the risk management approach. So the WHO Director General Tedros Ghebreyesus also saying that the issue of equity is very important, that in 100 days he hopes to see all countries with a vaccination rollout program already underway, saying that the world has been mindful that equitable access to quality healthcare is reminiscent of the days when H1N1 disease and HIV/AIDS medication was only available to the rich countries. Of course, a lot more was said. We will try and